Good morning. I'm Scott Mitchell. Welcome to the hot seat. Our guest this morning, the new president of the Oklahoma State Medical Association, Dr. Larry Bookman. Good to have you here, Doctor.
Nice to see you, Scott.
We talk about health, public health on this show a lot. It ain't good, as they say down in Garvin County. You're just sworn in as the new president of Oklahoma State Medical Association. What is your vision for trying to get us out of the basement?
My vision, the vision of the Oklahoma State Medical Association, is to work with the legislature and our governor to improve the health of Oklahomans, all Oklahomans. I've been working as part of the governor's transition team to formulate a plan, a long-range plan that will remove us from the bottom 5 states in the union and bring us up into a respectable number with the hope of eventually getting to a top 10 state. We're not going to get there overnight. We have a lot of work to do, and it's going to require change. It's going to require Oklahomans to change the way they think and the way that they act. It's going to require change in our education, both health education as well as general education. It's going to require change in our nutrition and dietary habits. Things like biscuits and gravy are going to have to go. We have to change our obesity rate, and with that comes exercise. We've got to get our children exercising. We've got to get our adults exercising. If you change obesity, you will affect hypertension, cardiovascular disease, and especially diabetes, all of which we rank at the bottom in this country.
Now, for years, we've had health bureaucrats telling this nonsense, right? And we've just plunged to the bottom. You're working with the governor, working with this administration. What do you think? How do you start gaining the trust back of the public who've been just basically lied to for many years?
They have been, and the trust has to come from being honest, by being out in the public, I plan to travel the state to talk to people, talk to our legislators, try to make some changes that can be made through the government, such as exercise in our schools, by putting good nutrition back in our schools, by getting rid of Coke machines and candy machines and replacing them with water and fruits. Those are things that can be done. To get the trust of the people and to change their behavior, you have to start with the children. Hopefully they can educate the adults. It's hard to change an adult's thoughts and behaviors, especially when it comes to nutrition. We understand adults, parents, both working, come home, it's easy to grab a meal. Unfortunately, those meals are not healthy meals most of the time. We need to change those sorts of attitudes.
We've got about 30 seconds left. People have heard for years the nonsense messages. What, besides our diet and exercise, there are other aspects to making a healthy public body, isn't that correct?
Oh, absolutely. We've got to change, and we've improved, but we have to continue to change our smoking, and especially what has happened now with teenagers is vaping. The e-cigarettes are not healthy. They're being promoted to our young people. We have to change that. We have to affect mental health and have better mental health in this state. We have programs that are hopefully will be instituted in mental health that will greatly improve our mental health status, where we are clearly at the bottom. We also have to affect just the general attitude. So it's a large, chronic problem. It's going to take the help of everybody to make a change.
Big challenge for medical professionals of Oklahoma. Dr. Larry Bookman, the new president of the Oklahoma State Medical Association. Congratulations.
Thank you.
Got a tough job coming up.
We do.
See this again at news9.com/yourvotecounts. Follow me, Scott Mitchell, on Twitter @MitchellTalks.